Well, hello and welcome. I am so excited to be talking to everyone today. I am joined with Dr. Miller from Miller Orthodontics, and we are going to be talking just a little bit about when your child should go see an orthodontist, why, and stay for the end because we're going to be talking about us moms and dads, and some of the issues that we may be seeing post braces, or some of us who've never had braces, some things that we can do to help our own smile. So Dr. Miller, thank you so much for joining me today.
Great, thanks for having me.
I really appreciate it. I just think I feel like almost everyone is a candidate for braces or some sort of care, and most of our children are going to need it these days. So when should I take my child to see you?
So the American Association of Orthodontists recommend age 7 is the first time a child should visit the orthodontist. And a lot of times at age 7, we're just looking, we're just checking things. Oftentimes we're not starting treatment at age 7, but it's good to at least build rapport with the patient and get comfortable with the office, and at least see what's going on, just so we can plan for the future. Especially with FSA accounts and stuff, parents always want to put money away and they always want to know when it's time to start. So we do like to see them at 7. Oftentimes we don't start at 7 unless it's really severe. Around 8.5 is usually when we start what we call phase 1. So.
Okay. And let's say like I have been seeing my regular dentist. They haven't really mentioned anything about needing braces, but I have a family history. I had braces, everybody in my family has braces, and I just feel like my child is going to need braces. Can I just come in and say, just tell me what you think? Would you be able to help me in that situation?
Yes, for sure. I mean, we a lot of pediatric dentists or general dentists are very good at spotting things early, giving the appropriate x-rays, and doing kind of a mini orthodontic exam for their patients. But oftentimes they're not paying attention to that. They're just looking for cavities, taking x-rays that only look for cavities, not looking for other things. So a lot of times it's not that they miss something, but they're just not looking. So yes, we have a lot of parents that just call us, find us on the website, find us online, for friends or family, and they just call us on their own to make an appointment for the child. And especially if crooked teeth and bad bites and things that are genetic. So if it's in the family and there's older siblings that had treatment or parents, certainly there's a pretty good chance your child will need some orthodontic.
Yeah. Well, that's good to know that you are more than welcome to bring someone in just to see what the options are.
Even with COVID now starting last year, we've even gone more virtual now and increased our technology. So on our website, we do have what we call a virtual consultation, where you can fill out some information, basic information, and you can take some pictures just with your cell phone of your teeth, either the child or parent. Just submit the pictures, and then we'll get back to you pretty much within a day or two with kind of a mini assessment of what we think is needed, or if it's a good time to just wait, or general fee range, things like that. So that's been a really great addition to our website and to our practice, getting virtual consults, because I know a lot of parents are of course busy these days, and with COVID restrictions, not everyone wants to come in for an appointment. So having them done virtually is a great option.
That is an amazing option. I love that. I mean, personally, if anything can be done online, I want to do it online. Like, if I can, anything I can do online. Ordering pizza, getting the car repaired, like virtual orthodontic visit, sign me up. Because also, too, trying to get your child out of school, and sometimes, you just, and I know a lot of kids sometimes have a fear of going to the dentist, no matter if it's just to look at their teeth. So this is an amazing asset that you have for your team and what you can do for moms in the area. So that is amazing.
For sure. Yeah, we always make the first visit, especially for younger patients, as fun as possible. Yeah. Usually we just take pictures, maybe one x-ray. I take a look at them. They get to spin a wheel for some prizes. And we usually, on that first day, we usually never do anything as far as treatment goes. So they don't have to worry about actually getting braces on. That is their first appointment. It's usually just a check.
I can vouch because I've been to your office and it's super fun. I've been to your office in Orange and it is super fun, super bright, super colorful. The staff is so friendly and So I'm sure anyone would just love to just hang out for just a little bit.
For sure. Sure.
So let's say we go in, you're like, yes, we need to do some intervention. And, I know that there are every single child and every single bite and every single mouth is going to be different and have a different plan. But can you tell me a little bit about like the phases? I know there's like a phase 1, phase 2.
Yeah.
So can you just kind of explain what that is?
Yeah, so a lot of parents ask about that because it's a source of confusion, I guess. Parents, they'll have their child in 2nd grade, 3rd grade, and then they'll see all their friends with braces. And they're like, why are all my son or daughter's friends getting braces? And should I be getting braces for my son or daughter? So phase 1, or it's also called early treatment or interceptive treatment, it's been around for a long time. People always ask, is it new? Is it a new thing? And it's not. It's been around 70s, 80s, but it's become more common. And that's because when we see something happening early at age 8 or 9, we jump in and do some limited care, but maybe about a year of treatment, limited care. We can prevent a lot of things from happening. And preventative care is the best medicine. So if someone has a lot of crowding, we can do some expansion, make room for the teeth so that we don't have to extract teeth later. If someone has bite issues where they have a big overbite or underbite, cross bites, things like that, again, we can get in there early and prevent major things from happening later. Sometimes with orthodontics, we do jaw surgery and things later on. But if we start early enough, we can prevent things like jaw surgery, and teeth getting stuck, and what we call impacted, where they get stuck. So if we can prevent all those things from happening, it makes, in the long run, it makes treatment a lot more efficient and a lot easier and a lot less problems later on. So it is a very worthwhile investment. Now, not everyone needs it, though. I mean, since we have a pediatric dentist in our office in both locations, in Orange and Aliso Viejo, we do, and she's very good at spotting things early. We do see a lot of kids at 7, 8, 9, 10. But only about half, or maybe even less than half, need phase 1 or interceptive early treatment, and half don't. And we just wait for all their teeth to come in, or for most of their teeth to come in, to start a single phase treatment. If someone does have phase 1, again, like around 8 or 9, we do about a year of treatment. We take off the appliances, take off the braces, give them retainers, and then we just wait for the teeth to come in, see how things develop. And then what we do is phase 2. Phase 2 is around age 12, 13, 14, when all the teeth come in. That's when we do a full set of braces and we finish things off, or even these days Invisalign for teenagers. So that's the phase 1 and phase 2. And the idea is that if we did a phase 1, phase 2 is very easy, very straightforward, very short, nothing major. We've done all the big work early on. So yeah, very important. Yeah, my daughter is in phase 1 right now, so I believe in it for sure.
Yeah, that was gonna be my next question, was if you are able to do phase 1, if you see the problems before you get to phase 2, does it then shorten the amount of time that maybe, or I guess that amount of intervention that needs to happen?
Yeah, it shortens. What phase 2 would be shorter, usually maybe a year and a half or a year, rather than 2 or 3 years of braces. And then it shortens limit the amount of appliances. So if we did an expander early, then you don't need an expander later. If you do, there's lots of appliances we use, but if we get in there early, we can limit how many appliances we use later on. And no teenager wants to be in expanders and headgears and all these appliances. So at age 8 or 9, they don't mind it. They think headgears are
cool.
I think it's cool, yeah. So they'll listen to their parents. They'll do what they're told. So if parents say, wear your headgear every night, we get really good compliance at that age. Getting a 13-year-old to wear headgear is impossible. So don't even try. So.
Well, and I know you said that phase 1 has been around for a really long time, but I feel like when I was growing up, people just didn't really get braces until they were in high school.
Correct. You're correct. Yeah, it was around, but not as popular. And the reason was orthodontists really reserved it for the most severe cases. So if they saw something really severe, they would jump in early. But they began to realize the more and more they used it and got comfortable with it, that on these medium cases, it was a good idea to do it as well, to prevent extractions and other issues. And back then, there was different philosophies, and things have changed a little bit. They used to extract teeth a lot more back then. So typically they would just see a patient, 11, 12, 13 for the first time. And then if there was crowding, then they would just extract 4 teeth and then do the braces and finish off the case. And these days we want to prevent extractions as much as possible. Still do them, but most parents and most kids want to keep all the teeth and get a big, broad, kind of beautiful smile. So we want to try to fit them all in. And that's why there's oftentimes more phase 1 now, is because we want to treat with non-extraction without removing teeth. So.
Yeah, that definitely makes sense. I mean,
Yeah.
I think everybody wants all their teeth if they
If possible.
possibly can. Yeah, definitely. Now, I realize that phase 1 and 2 may not save on like the cost, just because there are things, but it'll save hopefully on time. And then I know that your office offers some payment plans. So if parents need to, come in and stretch it out, that's totally possible. And there's different options for that as well. I know you guys are very flexible.
Yeah, we're
so no one should be afraid to come in and see, what needs to be done for their
No,
time.
for sure. I mean, we accept all PPO insurances, and then we extend payment plans. If you're in treatment for, let's say, 2 years, usually we let you pay over 2 years or more. Sometimes even 2.5 years, we'll let you pay.
And they can use
monthly installments and a small down payment.
That's awesome.
Down payment. And then a FSA.
Yeah.
You have an FSA or HSA that orthodontics counts for that, so you can use your FSA or HSA dollars for orthodontics. And then insurance. Even adults, which sometimes they don't realize, is they have orthodontic coverage, and their insurance plan will pay for $1,000 or $1,500 or $2,000 or sometimes more towards our orthodontics, even as an adult, with no age restriction. So, and that includes Invisalign. A lot of times they think it's only braces, but insurance companies will pay for aligners as well.
So we've talked about the kids, and obviously all of Dr. Miller's information is up above, and you are accepting new patients. So if you want to make an appointment or a virtual visit or whatever it may be, you can just head to the link that is above here, and they will be more than happy to assist you. And so you kind of just touched on adults. So, okay. Personally, I know so many moms and dads who, probably had braces or maybe didn't have braces, because like I said, it was a little bit different when we were growing up, who are now noticing the crowding, especially the bottom teeth, and are like, what can I do for this? And you also treat adults.
Oh, for sure.
And so can you kind of give us a little bit of information on, let's say I'm a 40-year-old mom and I want this fixed, but what are my options and what do I need to do? And what's the time frame?
Yeah, I mean, in the last 10 years or so, or 15 years, adult treatment's really exploded for sure. Way back when an orthodontic office was 90% children, but these days we're 30% adults, including everyone up to grandparents and braces and aligner treatment. So, what's common is everyone for the lower bottom teeth is what crowds up for everyone, even if they had orthodontics as a child. And let's face it, most adults, even if they had braces, they were told to wear their retainers, but they stopped doing it. So the T3 crowd, and then lots of options these days. So there's of course braces again. A lot of times we can do limited braces, just a few braces on teeth that need adjusting. And we have ceramic braces to do that, clear ceramic braces, which are porcelain, very nice, very aesthetic. There's Invisalign or aligner treatment, which is great. And then there's also inside braces on the website. That in brace is called lingual braces, so they're hidden braces. And those all work well. And a lot of times for adults, especially if they had treatment with a routine, the bite is good and everything's maintained as far as the bite. There's no major issues. It's just a little bit of crowding. So. Those cases typically, 6 months or 9 months of what we call retreatment is a very nice option, and you can get in, get out, and if you do aligners or hidden braces, no one will know you're wearing anything, which is nice. So, we have a lot of parents. Just last week we had a consult for phase 1, and the daughter was 9, and she didn't need anything. She was part of that 50% of kids that don't need a phase 1. So. But at the end of the consult, the mom's like, well, since I'm here, I had braces when I was a kid, and I did a retainer, and crowded up on the bottom and
Mhm.
take a look. And so she's going to come in next week for a consult for herself. So we do see that a lot for sure.
Yeah, that's great. And I think, especially, when you see your child getting their smile
Yes.
straightened, you're like, And 6 months, I mean, that's not
Yes, it's not too
that
bad.
long.
9 months. Sometimes adults have more complicated cases.
Yeah.
A lot of complicated cases as well. Patients that need implants and crowns and bridges, and their dentists at the moment because they need orthodontic treatment or orthodontic help to make space for an implant. Say if you're missing a tooth and the tooth's been gone for a long time, your dentist might want to do an implant, but there's no room to do an implant. There's not enough space for an implant. So they'll send the patient to us, and then we'll have to make some space. We'll make a proper space for the implant. And the implant can be placed properly and have a proper size tooth, good bite. So
Yeah.
yeah.
That's wonderful. Well, I know that, for myself and for my kids and for my friends, it's always good to know someone in the community who is advocating for the kids, and just someone who is going to tell you the truth. Like, hey, you don't need this now.
Yes.
Yeah,
we pride ourselves on that aspect. We're a very honest practice. We're very ethical. We don't overtreat patients for sure. A lot of patients are surprised. They come from other offices for a second opinion, and they're like, my son or daughter was in to see another orthodontist, and they recommended all these things, and is it necessary or recommend that? And oftentimes, sometimes we do. We say, yeah, that's a good plan, and you should go back there, and that's a good idea. But other times we feel it's kind of overtreatment and not necessary, and sometimes some offices are doing phase one on everybody, and we certainly don't. So we want to take care of our patients and only do what we would do if they were our son or daughter. So.
Yeah, and I think that's very much appreciated. And I know with your pediatric dentist, Dr. Martinez, you guys work in tandem together and have the same philosophy, which is very much appreciated. I know I took my son just not too long ago to her for cavities, so and it was just a relief for her to tell me, that the original place was correct. And so just having a team that is so caring about their patients and actually putting the patients first is so important to, I think, everybody. So
it's great having her there too. We share the same philosophy as far as treatment goes, and I treated her sons and treated them at the appropriate times, and then it is convenient for patients. Patients love they can get appointments the same day sometimes, so they'll see us and see her at the same time. Just one-stop shop, if you will. So it's nice.
And you have a practice in Orange, and then you also have a practice in Aliso Viejo?
Yes, correct.
Yes. And both offices are accepting patients.
Yes.
And virtual. And let's say someone does a virtual, they send in their pictures. How quickly can they expect to hear back?
Yeah, so usually it depends on what day of the week. I mean, if they said it's Saturday night, which sometimes I get alerts on my phone. So I did a 11 p.m. Saturday night virtual consult. So those ones might have to wait till Monday, but usually it's a day or two. We get a response back to them. Sometimes we can make a really accurate diagnosis and kind of give them a really good idea of what's needed or what's not needed. And then sometimes we don't. Sometimes we say, it's great you sent the pictures in, but we need a little more information. So we do need you to come to the office, maybe take an x-ray, see what's going on, see if there's a tooth that's stuck or impacted. We can't tell in the pictures. So, so then, but oftentimes the virtual consult's good enough to give the patient at least an idea of what's necessary. And then of course they do need to come in eventually to get x-rays and appliances made, whether there's line or braces or some appointments. We've also started doing, not so much with braces, but with the liners we have virtual appointments too. So app we have is called Dental Monitoring. We started doing it about a year ago, and then COVID kind of spurred us to really start doing that. So you download an app to your phone, and then once a week you scan your teeth with your aligners in, and then it just checks to see if your aligners fitting, and then we let you know if they're fitting well. And if they're fitting well, you move on to the next aligner. So because of that, we're checking in on you every week, which is great. Before, in the past, we would give patients 8 weeks worth of aligners and just tell them to change every week. And then when they come back in 8 weeks, we just hope that things are going well and hope things are fitting. But we wouldn't know. We would know for sure. The patients were kind of on their own. They're on an island. But now, no, every week we're checking in. We're checking, make sure the aligners are good. So because of that, for some patients, we can go 4 months, 5 months between seeing them in person. We just keep checking them virtually every month, which is nice. We have some college kids that are away, but we're checking in every week with them. Some really busy adults, some attorneys and things that just can't come in. So it's great. They can do virtual appointments with us every week for their aligner checks, which is great. So
I love that. I love all things virtual. Let me tell you. It's my favorite. Well, I just want to say thank you so much for talking with me today and just explaining what the procedure is, and also just the virtual aspect of what you do for kids and adults. I really appreciate it. And if anyone wants to contact Dr. Miller to set up any sort of appointment, whether it's in person or virtual, the website is above, and you can go ahead and make an appointment there. You can call. They're also very active on social media, so you can also do any of that. But thank you so much, Dr. Miller, and I'm excited to talk to you again. And I hope that a lot of people have gotten some information at the ready, and they are ready to come make an appointment. So thank you.
I hope so. Yeah, when they come in, they'll be really happy with what the information they receive. That's the number one feedback we usually get from new patients is we spend an hour on your new patient exam. So a lot of offices, they get you in and out. We spend an hour and we really thoroughly talk about orthodontics and needs and what's going on. So patients when they leave, they're like, wow, I learned a lot about orthodontics.
Yeah.
Maybe too much sometimes. But
that's okay. I feel like nobody wants to be surprised when it comes to what's happening in their mouth.
Oh, for sure.
No surprises there. So
sure. Okay, I appreciate you having me.
Awesome. Well, thank you so much for meeting with me today, and we will talk soon.
All right. Thanks, Mary.
Okay. Bye.